Good morning, good afternoon, and good evening to all participants, and welcome in today's session. My name is Allison, and I'll be your technical support together with my colleague Joe. So if you need us, feel free to send us a message by opening your chat tab and then selecting MTV Support Allison or Joe as your recipients. As you may know, today's session comes with interpretation in English, French, Spanish, and Arabic. To use the interpretation function, simply click on the interpretation button located on your menu bar below and select the language you wish to listen to. And then for those who are connected on a mobile device or on a tablet, you should be able to find interpretation hidden under More. Thank you very much and good luck.
Hello, good morning, everyone. Good afternoon, depending on where you are. I see Jonathan on the screen as well already. And my name is Poonam Dhawan. I serve as the ad interim director for migration health at IOM, as well as the senior migration health policy advisor. I've had the pleasure of working with some, if not several of you, and looking forward very much to this discussion today on leaving no one behind by addressing the needs of migrants towards universal health coverage. We are right on time here, and I'm going to get us started with a few opening remarks, before which, as was already mentioned by the technical host team, the meeting will be recorded. We will have a couple of set of opening remarks followed by some very interesting panelists sharing their perspectives on directed questions on the topic. And then we hope to have at least a 25 to 30-minute open floor for questions, answers, and comments from the various stakeholders present today. And it's the usual Zoom practices. So after the panelists have spoken, feel free to either raise your hand or leave your comments, questions in the chat box. And both the network secretariat as well as the co-leads and IOM colleagues are on standby behind the scenes to assist us. So having said that, let me begin by noting that this GCM talk is being organized under the umbrella of the new work stream 3 of the UN Migration Network. And this work stream is focused on preparing for future health emergencies by mainstreaming public health considerations into both migration policies and services at national and local levels. This work stream came about as part of our new work plan since the very successful first International Migration Review Forum and its progress declaration, and will be co-led by WHO, UCLG, and the major group on children and youth. As we all know, colleagues, there is much left to do if we want to achieve a world where health coverage is truly universal and migrants are not left behind. Access to basic health services, including maternal and child health services, but also coverage with comprehensive social protection, including healthcare, still remain elusive for many migrants and migrant communities around the world. And yet, migrants have been and continue to be frontline responders, heroes of health systems, responders in emergencies such as the COVID pandemic, but also other health emergency outbreaks such as Ebola, as we have all seen. Indeed, they also continue to contribute to socioeconomic development in host and receiving countries, and have in fact been seen to remit more in times of crises to their home communities. In this light, and with the upcoming General Assembly, we have a tremendous opportunity with the SDG Summit as well as the high-level meetings on three very crucial health topics: tuberculosis, pandemic prevention, preparedness, and response, and the topic of today's webinar, SDG 3, or universal health coverage. These meetings on health at the General Assembly at the highest political level will be catalysts for renewed commitments to effective strategies that can advance the health of everyone, everywhere, including migrants. We look forward to a rich discussion today as an opportunity to contribute to one of these key processes, the high-level meeting on universal health coverage at the GA. Some of you may be following that process already. There have been some very interesting discussions at the multi-stakeholder panel in New York last week. There is a very comprehensive UHC action agenda that was launched by the UHC 2030 partnership and other stakeholders. And of course, we have the very valuable leadership of the co-facilitators for this process. And we have one of them, Thailand, joining us today in the discussion. So with this, I would like to hand over to my dear colleague, Jonathan Prentice, as the head of the UN Migration Network Secretariat, to offer his own opening remarks. Jonathan, the floor is yours.
Thank you very much, Poonam. It's lovely to see you there. My comments can be very brief, in fact, because I think one thing I take out of this is that you and I should coordinate our comments better in the future, Poonam. You said it much better than I could, covering a lot of these issues. But it is really my great pleasure to welcome so many, now nearly 200 colleagues from around the world to this GCM talk on migration and preparing for future public health emergencies. I appreciate you taking the time out of your schedules, and I appreciate even more the contributions and the insights that you will give to us as we work through this issue. I'd like to just highlight a couple of points, if I may. One is, as Poonam referenced, the paradox that the COVID-19 pandemic shed light on, between, on the one hand, the severe and disproportionate impact that this pandemic, this virus, had on migrants worldwide, including increased exposure to the virus, discrimination, violence, job losses, wage theft, protracted family separation, and so on and so forth. Whilst on the other hand, the fact that this pandemic and our responses to it in communities the world over highlighted the central role that migrants played in keeping these societies going, even under the most immense strain. And I think it's really important that we learn from these experiences as we prepare for future pandemics, and that this work stream and this event, this GCM talk, is a very important avenue, I think, for helping to realize that greater understanding. The second point I would like to flag is that exactly this week last year, I can hardly believe it's already been a year, the first global review of the Global Compact, the International Migration Review Forum, took place, and it resulted, of course, in an outcome document, a progress declaration, in which states committed to providing migrants access to health services and continuity of care, irrespective of their migration status, in adherence to the principles of universal health coverage. Additionally, in this outcome document, in this progress declaration, there was a shared commitment to promoting the meaningful participation of migrants in policy discussions concerning issues that directly affect them, such as Poonam mentioned, the upcoming meeting on universal healthcare this September in New York. So we already know that access to health services, irrespective of status, is a commitment. We have already committed to ensuring that those most affected are involved in the policies that will impact them. This is a very strong beginning, I believe, for the progress, for the steps forward that we need to take. So we hope through these GCM Talk platforms to be able to bring together a wide range of experts, a wide range of different voices, both on the panel and amongst the participants, to help us tease out what some of the achievable policy goals are towards these shared commitments. So again, I'm extremely grateful that you are here. We need your inputs, we need your insights, and I look forward to your active engagement. And again, thank you very much for your time on this important issue. Poonam, I will hand back to you.
Thank you, Jonathan. And indeed, looking forward to more and better and coordination on all things to support health and GCM implementation. So look forward to that. Now, with those very pertinent and succinct remarks from Jonathan Prentice, it's my pleasure to open our panel discussion. We have about 5 confirmed panelists who will participate here as an opportunity of dialogue to share practices and commitments on migration health from their own experiences, as well as propose recommendations, for the processes that have been referred to here for the GCM implementation, as well as the universal health coverage discussions at the General Assembly. So with that, I'd like to invite the first panelist, and I see him here on the screen. A very welcome to Dr. Derek Sudan, Director, Division of Health Economics and Health Security, Office of the Permanent Secretary, Ministry of Public Health, Thailand. Very warm welcome to you, Director. Thailand is, of course, one of the co-facilitators for the high-level meeting on universal health coverage. Therefore, could you please share your example on how Thailand is walking the talk on UHC and health of migrants? In addition, could you share some of your own expectations for the upcoming political declaration, this General Assembly on universal health coverage, from the perspective of migration health? Dr. Sudan, the floor is yours. And if you can keep your remarks to 5 minutes.
Okay, good afternoon, everybody. My name is Dr. Derek Sudan. Today, I share some expectation and for the UHC political. The Thailand in this has a notable track record in implement universal health coverage and addressing the health need of migrants. The country has made a significant effort to walk the walk on the universal health coverage and migration health. Have some example. Health coverage for the migrant. Thailand has implemented policy to ensure that migrants have access to the essential health service. The Thailand have the 30 baht. 30 baht is approximate $1. The country 30 baht scheme provide affordable health care to all, include the migrant. Through the National Health Security Office, migrants can enroll in this scheme by paying a nominal fee, which grants that access to a wide range of healthcare service. The migrant health insurance, Thailand has established dedicated migrant health insurance, include general health care, antenatal care, immunization, and treatment for the infection disease. They also facilitate health education and promote awareness of health issues among the migrant community and benefit like the universal healthcare in Thai citizen. It means if you are migrant in Thailand, you pay the cheaper, you pay for the health insurance cheaper than the Thai citizen, but you can benefit package is the same Thai people. You have the same medical, you have the same treatment like the Thai people. Yeah, because we focus on the migrant group because it's very to have a migrant worker come from the border from the nearly country in Thailand. And the most important, the collaboration with the international organization is the most important. The Thailand has cooperated with the international organization, with the International Organization for Migrants and WHO to develop the program and initiative the address of the health need of the migrant. About the upcoming universal coverage political declaration for my idea, I think the UHC political declaration should emphasize the importance of including the migrant in national health system and guarantee their access to the quality healthcare service without the discrimination. It should advise the policy and ensure equal access to the healthcare for all and regardless of migration status. But I think the most important is the cooperation and the partnership. The most big problem is a budget. In document group of migrant is not it have a pay for join together, but undocumented group is very important. I think where we will have the national fund to take the money from the many countries to join to take care for undocumented group. It is very important for the future for the in Europe for my idea. Thank you very much.
Thank you very much, Dr. Sudan, for those very comprehensive yet very precise remarks. You have indeed reminded us again about the stellar example from Thailand in terms of the migrant health insurance mechanisms that are inclusive of migrants, and also what you mentioned about the importance of partnerships as well as the importance of looking into funding mechanisms. So indeed, we look forward to a very pertinent and politically sort of taking us forward tone and content for the political declaration. And you've indeed flagged some very important issues that could be reflected therein. So thank you again for those remarks and for also joining us late in the day there for you. As the next panelist, it's my pleasure to invite Mr. Mauro Sanchez, Deputy Secretary of Health Surveillance from the Ministry of Health, Brazil. I see you there on the screen. Thank you so much for joining us. Could you please share some of Brazil's examples in making progress towards the health-related commitments of GCM and realizing universal health coverage, as well as the right to health for migrants? The floor is yours.
Thank you very much. Thanks for inviting us. Unfortunately, the secretary could not be here. I'm the deputy secretary, as you just said, for health and environmental surveillance. And can I share my screen so I can? Okay, thank you. I have this brief presentation. If you can just confirm that you can see it.
Yes.
Okay, thank you. So I'll be brief. We just want to present briefly the initiatives that Brazil has been undertaking in the topic of migration health and trying to tackle the issue of universal health coverage and rights for migrant populations in Brazil. This is a brief overview of the number and profile of the migrants that have been coming into Brazil in the last 12 years. You can see there was a spike in 2019, then the pandemic affected heavily this number, and mostly we have migrants from Venezuela due to the humanitarian crisis that happened in that country that borders Brazil in the north. Brazil has in its constitution the right for health. It's not a privilege; it's a right, and this extends to migrants as well. So it's a health law, as I said, and there's also a migration law that ensures access to public health, public services without discrimination and on grounds of nationality and immigration status. So this extends the rights to access to health to people regardless of nationality, as I said. So that guarantees health and health coverage to migrants as well. Our health perspective is that health is a right, as again, as I said, not a privilege. Migrants have access to all levels of care, not just primary health care, but secondary, any level of care that's needed is guaranteed to migrants as well. And this is in line with national policies that guarantee fight against stigmatization, stigma against migrants and refugees, so they're not considered as any risk to public health on the host country. These are the basic principles of our unified health system: universality, equity, and community participation, which again, as I said, also applies to migrants. I won't go into detail because of time, but if you want, I can give you more details in the discussion part of this session. We encourage community participation. So, for example, recently, soon we'll have a Migrant Population Health National Conference organized by the civil society movement, which we encourage, as I said, as a principle of our health system. And also have national initiatives that address this issue as well. In the Ministry of Health, we have working groups that deal with surveillance and migration, trying to align policy for migration issues within the Secretariat for Health and Environmental Surveillance, as well as within the ministry across secretariats, which is important as well. In addition, we are trying to guarantee that in the information systems that Brazil has, migrants have also a field that can be identified as a person, so they don't become invisible in our national health registries. Well, of course, we deal with multiple stakeholders, as many of them are here in this meeting: IOM, UNHCR, PAHO, which is part of the WHO, of course, as you know, and our Ministry of Environment and Climate Change. And going towards the end, we had this operation, which is called Operation Welcome, which is a translation of the name in Portuguese, which was done to address the issue of the heavy Venezuelan migration that happened recently, which guarantees all the rights that I said in the past few minutes. Also, we have initiatives that guarantee vaccination in the borders. So we have in red, you can see in the map cities that are considered as twin cities. So we have another city on the other side of the border, and sometimes it's a dry border. You cross a road, you are on the other country, and we guarantee vaccination in those cities and also in the municipalities that border the countries that have borders with Brazil in South America. And lastly, I want to highlight that there's a network which is called in Brazil Rede CIEVES. CIEVES is a network for rapid response for emergencies, and these emergencies are addressed also.
Excuse me.
Excuse me.
Yes. Yes.
We can't see the slides. They're not moving.
Oh. Okay. Okay. I'm in the last slide. I was just going to say that we have local initiatives as booklets, committees, etc., and encouraging migrant workers, migrants to work as community health workers as well. That was my last slide. I don't know how much. I'm going to stop sharing. Is it here? No. I'm sorry. I'm sorry. Where? Okay, here. Okay. I don't know how much you missed. I thought the slides were passing, but that's all I had to contribute at this point. I don't want to take too much time, and we're open for any comments that you might have. Thank you.
Thank you. Thank you very much. I believe our tech colleagues also tried to connect with you, but no matter if you and the team are in agreement, perhaps the work stream co-leads would be so kind as to share your presentation with those of us who were registered, but we can check in with you about that offline. Irrespective of the slides, thank you so much for sharing all of those good practices, which can indeed serve as an example or a model for others to adapt in terms of advancing health-related commitments for GCM implementation, especially also at local level. So indeed, look forward to the discussions and questions when we open the floor, and I hope you can stay with us for the rest of this panel discussion and event. With that, and Ms. Amelia says, I see you on the screen here. You're the Secretary General for UCLG, United Cities and Local Government. So in fact, a big thank you to begin with for being the co-leads for this work stream with our colleagues at WHO and the Major Group for Youth and Children. You also recently spoke, I was there last week in the multi-stakeholder hearing on UHC, a very interesting and animated and dynamic discussion of stakeholders. You referred to the importance of including communities at all levels, of course, to advance commitments for universal health coverage. So could you share some thoughts on what can cities do to make this happen, especially in the case of migrant populations and migration-affected communities? Over to you.
Well, thank you very much, Poonam, and thank you to everybody, and congratulations to the speakers before me. A very hard act to follow with these very good practices that they have presented. Allow me to start by saying how much we are enjoying being part of the colleagues of this work stream and how much we are learning, and the hope that we have that this will impact in the policies that are put in place by local and regional governments around the world, because we feel that local and regional governments have a very critical role to play in leaving no one behind, ensuring that all policies reach everyone and everywhere. And this is what universal health coverage means for us. When Johan Prentice was talking about what the pandemic, the effects of the pandemic, I would summarize that for our constituency of local and regional governments, for the cities of the world, what the pandemic has done, among other things, is to put health in a different place of the agenda. Health is now in connection also with international issues, because we have seen how health connects with health security. So universal health coverage is actually now very important as a connection with security. And this is where migration also plays a very important role. As collective, we defend that migration is a natural phenomenon, and that the management of migration and the way that we deal with arrivals in our cities is the same way that we need to deal with neighbors. And if we go through that principle, the access to every single service provision is critical. Universal access to service provision is crucial, and so it is also to health services. And putting the health issue in a different place of the agenda makes us understand also that health is not only about medical care, but is also around many other things, and acknowledging rights independently of your status, access to jobs, to education, but also to housing, to adequate living conditions. And this is what we think that cities can play a role in. Adapting local service provision for migrants, ensuring that all the arrivals receive services, no matter what their status are, adapting local service provision to their needs. You know, new cultures need new things. They need to be understood. So there is an important part of training of local service providers in these new needs, in the new cultures, in things as simple as languages that are very critical for adapting service delivery, but going also as far as to ensure that we work with other spheres of governments to ensure that that migrants are including in also shaping the type of services that they need to receive. When I was at the stakeholders hearing last week, we realized that, of course, the legal frameworks and the competencies and capacities of the different countries around the world might change, and that is certainly true for our local and regional governments. But there was one single point that was recurrent, and that is the capacity of involving communities in decision making to shape the services that they receive. And this is absolutely true also for healthcare. The importance of issues such as mobility, transport, waste management, water, and housing for health are extremely critical. And the discussion that local and regional governments need to have, first with communities and then with the national governments to shape health policies are critical. And migrants are a very important part of that community. It's internal migration, but it is also external migration. Healthcare it goes far beyond medical assistance, as I was saying. And in order to achieve Objective 3 of the SDG agenda, we will need to work on Goal 11 on sustainable cities, but also Objectives 1 on poverty and hunger. And we will need to manage as well issues around decent work and inequalities. If we want universal healthcare to be put on the agenda, cities will need to plead for that, and we'll need to work on these areas. And I would like to leave you also with one last thought. Although healthcare is not a competence of local and regional governments everywhere, primary healthcare is a competence of many local and regional governments, and schools and education as well. And those are extremely important entry points also for migrant communities. So we are very excited to develop with our colleagues opportunities for peer learning among cities, and to ensure that universal healthcare becomes a political priority, to support national governments in developing enabling laws and regulations, to strengthen all service provision that can support healthcare from an approach that goes beyond sickness, but the environment and the quality of living. We commit to investing more in communities, but also people with disabilities will be critical in this endeavor. And unfortunately, migrant communities embody many of those communities in one. We are ready to move together with you and look forward to developing further learning tools, but also enhancing the awareness of our constituency about the importance of universal healthcare, and bringing this to not only the SDG Summit, which I think is very critical, but also to the Summit for the Future and the social summits coming up. We look forward to working further on this, and a big opportunity is the upcoming high-level political forum where SDG 11 will be under review. So when thinking on SDG 3, please do not forget the relevance of SDG 11. Thank you for your time and looking forward to the discussion.
Thank you. Thank you very much, Amelia, for such rich ideas and thoughts. Indeed, a loud and clear call to look across at all determinants of health. Sometimes, indeed, the solutions can often lay outside the health sector. So looking at whole of government approaches, but also looking at local governments and the leadership they can provide in bringing the communities along with them. And then, of course, the multi-sectoral approach and the whole of society approach. You spoke about social services, you spoke about housing. Indeed, education becomes a key player when we talk also about coverage with health services as we empower communities. So thank you very much, and all the very best also, and please do continue to bring these messages for inclusion of migrants forward in the process from UCLG for the high-level meeting on universal health coverage. So indeed, thank you for that. With that, it's a pleasure for me now as a rather ancient but still an ex-medical student to now give the floor to Mr. Mahmoud Al-Hamoudi, Vice President for External Affairs at the International Federation of Medical Students Association. So welcome, Mahmoud, to this GCM talk. Again, having been actively engaged at the multi-stakeholder hearings in New York last week, I understand something you said was, and I quote, the backbone of UHC is the people. This means human rights, equity, inclusion, and meaningful engagement, quote closed. So in this regard, what are, from your perspective, potential actions for meaningful engagement of migrants? And how can we ensure equity and inclusion are included in the political declaration? Over to you, Mahmoud.
Thank you so much, Poonam, and hello, colleagues. First of all, I think it's very important to start by anchoring meaningful engagement as a right, meaningful participation as a right. Now, we always say that health is a human right, but then we need to debunk or deconstruct what this means. When we say health is a human right and healthcare is a human right, it means that there is a right holder, there is a duty bearer. The duty bearer is always responsible towards the right holder, making the right holder, which is people in a sense, and in this context, migrants, in this context, every member of the community towards healthcare, the start and the end of planning, thinking, implementation, and all responsibilities related to the fulfillment of this right. So this puts people, humans, in other words, at the core of the implementation and the fulfillment of this right. Now, this is from the human rights language, but if we speak specifically about the vision of universal health coverage, the very first word of the term UHC focuses on universality of healthcare, focuses on the population coverage of healthcare. So we can minimize the financial risk, we can increase service coverage. But then if population coverage is not inclusive, if population coverage is not increased, we will never reach universal health coverage. And that puts people at the center of the vision of UHC and makes it essential to reach out to those left behind and to those marginalized in order for healthcare to be truly universal. Now, what does people-centered systems or people-centered healthcare and so meaningful engagement look like? It has two main elements. First, it means that healthcare, as a result, out of this participation, out of this people-centeredness, will be affordable, accessible, safe, ethical, and holistic. And for all of that to happen, this needs to be based on the evidence gathered on the needs from people, on their situations, on their context, and on how to reach or like to bring health to their borders. Then the second aspect is that populations or communities need to be informed about their health. That's one aspect, getting the information. But the second aspect, and also as crucial and as important, is for people to have or to be involved in decision-making about decisions that impact their health and well-being, and having a choice and a say in those decisions. So it's not the mere consultation of people, not the mere putting people at the chair or at the table of the decision making, but it's having a choice, people having a choice in deciding on the future of their healthcare. This is very crucial in the context of migrants. Migrants need to be involved in designing health interventions that will, at the end of the day, benefit them or serve them, in other words. Now, how or what kind of recommendations, also to be practical, what kind of commitments are needed in the political declaration on the political agenda in order to push for or to ensure meaningful engagement. Now, first of all, we need to start with the predisposing factors for meaningful engagement. We cannot have meaningful engagement on a very weak basis because that will not be sustainable. What does we mean by predisposing factors? Now, in order to ensure that, or meaning the meaning of predisposing factors or addressing predisposing factors and ensuring meaningful engagement is having migrants integrated into the communities as members of the community, not being seen as different people, as an exclusive group, as an extra group outside their group. They are members of the community, and that is essential. This, in practice, means the elimination of structural discrimination and also discriminatory behaviors, through raising awareness, through the implementation of laws and legislations, and also through the revision of policies to eliminate these barriers, in other words. So as to shift the narrative surrounds migrants from outsiders, once again, into insiders, into core members of the community, and rather than extruders. So that's number one. Number two, with that change, with that shift in the predisposing factors and establishing migrants as a core member of the community, we need to have enabling factors for participation and for engagement. And this means that skills and resources that facilitate the engagement of migrants in the decision-making or in the design of policies should also be scaled up. It's not enough to create spaces, which is part of the resources, to have the space, to have the table, to have the chair for migrants and the decision-making. You need also to ensure the skills on both sides, from the decision makers and the policy makers, in order to be able to understand how to collect the input of migrants, how to deal with the input of migrants, how to navigate it, and also skills towards migrants to be able to navigate the political agenda or the policy design system and decision-making system. With that enabling factors, there is also the need to create the avenues in a sustainable manner. So it's not enough to think of migrants as only one chair out of the decision-making table. There needs to be more interprofessional approach into decision-making, ensuring that the variety of professions and the variety of the community members are engaged in the process. Because migrants are part of the workforce. Migrants are part of the beneficiaries, let's say, or rights holders, in other words. So you need to ensure the whole spectrum of the migrant population represented in the decision-making, because that is essential. And then the final factors, and that's also very important, once we create the resources, whether it's in the form of the platforms, whether it's in the form of the avenues for engagement, but also in terms of also skills and empowerment, it's very important that we have some reinforcing factors. And these we can divide into two. One, accountability, and two, in terms of legislations or structural engagement. Engagement cannot come as only a decision of those responsible for the decision-making. It needs to be integrated in a structural manner in the system of decision-making, in the processes, in the regulations, in the internal operating guidelines, however we call them, whatever guides decision-making and policy design in a structural manner. Because otherwise, we risk missing out on the groups, on the different groups, and their meaningful engagement on the long term. based on the intentions of people. The second aspect is accountability. Now, accountability for the engagement, accountability for the input collected, accountability for the evidence gathered from the populations involved is essential. It's not enough that you have and collect the input of migrants, but it's very important as well to reflect on that input and tell them how their input was used and convey to them and inform them that based on this input that we collected from you, based on these needs that we have identified according to your input, we did 1, 2, 3. This accountability mechanism, this feedback is essential to reinforce meaningful engagement from both sides, both to ensure that migrants have the motivation and have the will to continue engaging this in the process, but also to ensure that there is transparency, that there is accountability and answerability to the engagement of migrants. With that, I conclude and go back to you, Pona.
Thank you very much, Mahmoud, for your enthusiasm, for your participation also in the multi-stakeholder hearings, and to the Students Association for these very pragmatic yet very deep suggestions you make, of course, with the overall messaging of keeping people at the core, but then also highlighting some practical gaps and possibilities, whether it's capacity development to have the right skilling, both on the sides, let's say, of the providers and the communities, as well as accountability. You know, we speak a lot of accountability for affected populations. You've rightly brought up ideas such as feedback mechanisms and improving processes and policies based on feedback. So some really good suggestions there for all of us to bring forward. And again, good luck to you and the association in continuing your efforts between now and the General Assembly in this regard. So thank you again. With that, last but definitely not the least by any measure, happy to see you again, Mayada, though virtually. It gives me great pleasure to introduce Dr. Mayada Adil. She's a medical doctor, wait for it, but also a fashion designer and co-founder of Lalu Creative. So you have to be ready for very many more creative ideas and suggestions going forward. And the question we pose to Mayada is for her as a migrant and youth voice to tell us what she recommends as potential actions for member states to promote meaningful participation of migrants in policy discussions, including those on health. So Mayada, the floor is yours.
So hello, everyone. I'm really pleased to be in this table, in this round table. And it's hard to be the last panelist because most of the points or most of what I prepared already been said and already been discussed. So it will be easier for me to share a personal experience as a migrant when I migrated as a doctor and then shifted my career. And then after that, initiating small initiatives for refugees and migrants in France. So starting by that, I migrated literally to France 9 months before the COVID. So my first step to try to integrate in the society is just trying to equivalent my bachelor in medicine and my MD. And the first thing I have faced, it's been said that your certificate cannot be equivalent easily because you're coming from the global south, and then you have to repeat the medicine, study the language at first, and then you have to do it in 6 more years. And I said to myself, this is going to take longer. I have to shift, and then I did the shift, and I did the master, and then the COVID happened. And I received an email from UNHCR requesting migrant doctors to come to work in the front line for the COVID. And in my head, I was asking myself, without even asking for equivalent of certificate, that means that is not a necessity where you come from, first of all. The language is not a barrier to consider in that sense. And it made me question a lot of things. What are the policies to deal with the doctor migrant from a government of the North, or how we've been viewed, our education, we're not compatible. So a lot of questions that it take me to, it was a discrimination policies. They only use a doctor as a tool sometimes to fit the needs of the state. So doctors, by essentially, they're a decision maker, not just the tools. So we created, I did not unfortunately do it, so because I was transferring to do my master's, I decided to do a small initiative with a group of Sudanese in the Sudanese migrant community. And I was doing this e-consultations. While we're doing the e-consultation with a lot of migrants, we find the issue of, by doing a lot of research and data collection, the issue of the mental health. This is a backbone of the migrants when they move from a society or from a communities. They immigrated from war, immigrated from the difficult situations. I think the first thing they face, the mental health, the cultural shock. They need more trainings. They need more orientations from the health care services provided by the host governments. So I think when I prepared my points, this roundtable, it's a great example of inclusiveness of how we can all sit together and we share our experiences and we share our recommendations, but also taking it as a point of action, what we can do in the mental health, how we can integrate a migrant doctor in the host communities without having these barriers of culture and trying to find solution with that sense. Also, it has to be multi-stakeholder engagement, as all we know, all been discussed before. Capacity building. I mean, for me, I think at that time, if I wanted to be working in France as a doctor, it will be easier for them to facilitate a lot of workshop for us. But at the moment that they ask all just to start working in the hospital, bring your certificate and start working in the hospital. So I felt there is a lack of organization to deal with the COVID issues. Of course, the accessible information to me as an immigrant in France, it was very difficult for me to find a doctor and how to understand the system. So there's no orientation for migrants. Again, they also talked about, Mahmoud before me talked about the accessible information for the migrants in the decision making. Addressing the discrimination and stigmatization, as I mentioned, states should actively work towards eliminating those issues and towards migrants, and particularly in the healthcare sector, by addressing these barriers. Government can should create an environment that fosters migrants' trust and encourage them to participate in decision making, because sometimes they feel they're excluded and they want to be isolated, to be excluded, because there is a gap between understanding those policies are made for them, or it's a high level for them. To me, I understand that I came as a privileged migrant. I understand that with this type of education, let me understand. Even I met you, Bram, in one of the high level G talks, but this is not always the case there is no outreach from the international organization to the grassroots people and individuals and migrants. So we need to focus more on outreaching the migrants in the host countries, and by implementing those recommendations perfectly, state can promote the meaningful participation of migrants in policy discussions and issues affecting them, including those related to health. This inclusive approach will help ensure that the unique needs and perspective of migrants are taken into account when formulating policies and programs toward achieving universal health coverage. And thank you for having me.
Thanks so much, Mayada. And indeed, we hope that voices and migrant community representatives such as yourselves continue to be with us along the way. So this is This is part of a series of dialogues, discussions, opportunities to have multiple stakeholders, including governments, including local governments, student associations and youth such as yourself. So we can also evaluate and we can reassess where we are and redesign and be open to reframing how we approach health-related commitments for GCM implementation. So thank you. And again, thank you for bringing up, reminding us how inclusion in its most practical sense is in itself a point of action that we should be taking forward. So with that, a big thank you to all the formal panelists in the GCM talk today. I'd like to now hand over to WHO colleagues, also a co-lead for this work stream 3. And I have with us here Rita Sa Machado, a senior policy advisor with Public Health and Migration, who will kindly provide us with some closing remarks. And before I hand over to Rita, I'd also take this opportunity on behalf of the workstream co-leads and the network to remind all our participants that if you wish to take the floor, please do raise your hand already within the Zoom platform. Thank you, and Rita, over to you.
Thank you, dear Poonam, and thank you so much for this great panel that we are seeing today. Our apologies on behalf of Santino. He was the one doing this closing remarks, but unfortunately was pulled to a very urgent matter. I wanted to start, first of all, that saying that our expectations for this panel, they were completely, thrown, and they were even elevated because, first of all, when we as co-leads put together this GCM talk, we wanted to have an interactive discussion, and we are still going to have that discussion after my just brief comment. Also, we wanted to hear from migrant voices, and I think we already have heard it, and we will hear more for sure. We also wanted to hear from, youth, but also senior colleagues, also from the grassroots and communities. And I'm pretty sure that, from our perspective, we will have a very difficult task to put together this very lively report that we want from the GCM talk to inform the negotiation process of the UHC political declaration. So having said this, I'll go straight to what was exactly what we planned to you, just as a very brief closing remarks. That is really with great pleasure that we are here as one of the co-leads together with the UCLG and the Major Group for Children and Youth, but especially also with the members of our work stream. Without them, we could not take our work forward. So on the 9th of May, just last week, in the opening of the interactive multi-stakeholder hearing on universal health coverage, in the preparation for the UN high-level meeting on UHC that you have heard today, the President of the UN General Assembly started by saying that health is a smart, long-term investment in sustainable development. And we could not agree more. So if we agree, why has the progress on UHC stalled and in some cases reversed? Why are we not including by default refugees and migrants in the efforts to achieve UHC commitments? And these are two important questions that we should keep in mind also for the discussion. Accelerating progress toward universal health coverage and delivering on political commitments made in 2019 has never been more urgent. And collective action will require greater political dedication and the necessary resources to ensure that policies for health systems and services include refugees and migrants regardless of the legal status. In the long run, the authoring of refugees and migrants needs to be reduced and eventually removed to avoid us versus them discussion in policymaking and society at large. That's so important to include migrants in this conversation. So clear plans of action and implementation are needed and have been needed so far at the subnational and national levels. And USCLG has referenced that very clearly in order to have the real impact contributing to local actions and accelerating progress toward global goals and targets. It's essential to support a radical reorientation of health systems towards primary healthcare as the foundation of UHC, and this must be coupled with a shift towards health promotion and disease prevention by addressing health determinants and risks, strengthening systems and tools for epidemic and pandemic preparedness, supported by governance and financing reforms, also harnessing the power of science, research, innovation, data, and digital technologies. This also means focusing on the least served, most vulnerable populations, particularly women, children, and adolescents, and refugees and migrants also. It emphasizes ensuring access to vaccine, medicine, diagnostics, devices, and other health products. And finally, on the essential issue of human resources, it emphasizes investing in the health workforce with a training, skills, tool, working environments, and fair play to deliver safe, effective, and high quality care. And these are foundational elements for our program here in headquarters at WHO, the Health and Migration programs, but also in the regions. And I can see also some regional colleagues in the line. Based on the experience that we gained through COVID-19, WHO has identified 3 components necessary for implementing an integrated approach to policies addressing migration and public health. 1, the protection-sensitive access to territory, the migration status flexibility to facilitate regularization of the status, and also the non-discriminatory access to healthcare, providing equal access for all, regardless of status, nationality, gender, age, or ethnicity. So the inputs today, as I referred in my first opening thought, is that the inputs today that we are collecting will be streamlined into a report and inform the 2023 negotiation process that we are just doing it. And we must ensure that in next September, world leaders will endorse a comprehensive political declaration that can contribute to the achievement of the GCM goals and also SDG targets. Thank you so much. And Poonam, over to you. Thank you.
Thank you very much, Rita, for those remarks and very strong recommendations indeed. Also that through this work stream and the network as well can hopefully be shared with the next steps for the process for the high-level meeting on universal health coverage. But also, in fact, as you also referred to preparedness, you also referred to other aspects. There are strong interlinkages, of course, between SDG 3, universal health coverage, and how the world sets forward in terms of pandemic prevention, preparedness, and response. So thank you for those remarks, and we hope those, together with the good inputs from panelists, can indeed form a set of recommendations from this GCM talk to the co-facilitators for the various health high-level meetings. So with that, and thank you to our audience, I see everybody followed suit with the request, and in no particular order, because I couldn't see which hand went up before the other. I will just give the floor. I have about 6 names here listed, and then if there's more, I'm happy to take another round. May I just request you to keep your remarks to at the maximum 3 minutes, so we leave some room for any other colleagues to speak. I'd like to give the floor first to Mr. Mohammed Al-Arada from Kuwait, and Mr. Mohammed will be followed by Mr. Vladimir Pascual Revello. Mohammed, you have the floor.
Thank you very much. بداية كل الشكر للمنظمة منظمة الهجرة على الدعوة والمشاركة، وأيضا نشكر جميع من سبقوني في الحديث. الجميع يعلم أننا نعمل من أجل حماية العمال المهاجرين، وأن عالم العمل هو من أصعب العوالم ويمر بظروف صعبة جدا للغاية. ضروري أن تكون أجندات الاتحادات العمالية هو موضوع الصحة للجميع. لدينا قانون رقم 6 على 2010 قانون العمل في دولة الكويت ضمن أن الصحة للجميع ولم يفرق بين أي جميع العمال. ضرورة أن يكون للعمال المهاجرين وعي في البلدان المرسلة والبلدان المستقبلة. كما عملنا نحن في الاتحاد العام وقعنا اتفاقيات تعاون مشتركة بين الاتحادات العمالية، وأيضا وضعنا في برامجنا القادمة مع المنظمات مثل الاتحاد الدولي للنقابات ومنظمة العمل الدولية ومنظمة العمل العربية ومركز التضامن على أن تكون موضوع الصحة على رأس الأولويات. التأمين الصحي في دولة الكويت على العمال إلزامي على جميع العمال. في 5 مايو الماضي و26 مايو القادم نظمنا ورش في الصحة للعمال الفلبينيين والعمال المصريين. ضرورة أن توقع الحكومات على اتفاقية الصحة والسلامة للعمال، وأيضا ضرورة أن يسلط الإعلام أن العمال المهاجرين هم جزء لا يتجزأ من المجتمع وأن نحافظ على حقوقهم. شاكرا لكم حسن الاستماع.
Thank you very much for sharing your perspectives and for those remarks. Mr. Vladimir, the floor is yours now, followed by Dr. Sarita Donti.
Muchas gracias. Felicitar porque ya era importante que tratemos este tema de la salud. Soy un inmigrante aquí en España y primeramente queremos instar a los gobiernos a que contemplen la salud de los migrantes como una salud fundamental para todos nosotros, para todos los migrantes, que todos los gobiernos contemplen la salud, ya que si nosotros estamos bien, que estamos trabajando en vuestras empresas, en vuestro campo, cuidando a vuestras personas mayores, a los niños y niñas, si estamos bien, podremos hacer bien nuestro trabajo. Segunda cuestión importante, queremos que también se trate la salud, no solo la orgánica, sino la salud mental que día a día la sufrimos, la vivimos los migrantes, ya que muchas veces la policía, los cuerpos y fuerzas de seguridad son entidades estresoras que prácticamente nos enferman porque vivimos inseguros de ellos. Pensamos que permanentemente nos van a detener, que nos van a llevar a las cárceles. Entonces estamos viviendo permanentemente estresados. Y el gran culpable, pues aquí son los estados. Los estados tienen que reconocer que nos están causando múltiples enfermedades psíquicas a todos los migrantes. Y luego también pedirle, igual que lo ha dicho la compañera anterior, la médico, que los migrantes médicos, enfermeros, todo el personal que trabajaba en la pandemia, todos ellos fueron necesarios y les dieron papeles. Pero luego cuando terminó la pandemia, ya no eran necesarios, les quitaron y los volvieron a la situación de antes, de irregularidad. Por lo tanto, instamos a los gobiernos a que los contemplen a los migrantes, no solo enfermeros y enfermeras, sino de todo tipo, pues, oye, si son útiles, pues les vamos a regularizar, que tengan sus papeles y también de esta manera que podamos aportar al país. Muchas gracias.
Thank you very much, Mr. Vladimir, for those remarks. Dr. Sarita, the floor is yours, to be followed by Samuel Jose.
Hi, thank you for the invite, and it was a really intuitive and thoughtful discussion. But my question is, like, there are in many countries there are no mental health programs developed for migrant workers or the dependents who are unemployed of the migrant workers. And since there is no mental health care plan, especially when it comes to postnatal and postnatal care with anxiety, depression, and postpartum depression. So how can we try to mobilize these programs which are in a cost effective manner, so that no one will be left behind? Yeah, that's my question. Yeah.
Thank you for that. Thank you for that question, Sarita. I'll go back to one of our or any of our panelists who wish to address that after we've heard from.
How is World Health Organization going to mobilize it? That's
Okay.
that's the best way to summarize it. Yeah.
Okay, I can also give the floor to Rita from WHO. Allow me to first give the floor to Samuel Jose, to be followed by Kennedy Achakoma to hear from the floor.
Thank you, Madam Moderator. As a youth, I do not take this event today for granted, but to convey some considerations en route to our high-level agenda. My name is Samuel Jose. I'm from the UN Major Group for Children and Youth, but I'm taking this intervention on personal level. Universal health coverage must really consider the existence of irregular migrants whose human rights are oftentimes stripped due to constrained national frameworks. However, some challenges remain at the national as well as the regional level. First, lack of systemic data, disaggregated by migration status and other characteristics, human rights violations intersecting with challenges such as social protection, and differences in interest between countries of origin, transit, and destination regarding shared responsibility of covering health services for irregular migrants. Therefore, it is hoped that the multilateral intergovernmental processes on our high-level meeting later on and other United Nations framework can take a far more ambitious achievements, especially in enabling countries who are struggling with their social protection policies to take transformative actions to enable them, the underprivileged countries, the developing countries, to provide healthcare for irregular migrants. Pandemic may be over, but COVID-19 is not the only current threats. Hence, UN must be strengthened on their program of work, especially with the UN country team, to enable comprehensive, preventive, and curative health programs which contribute to physical, mental, and social well-being of migrants, enabling them and host communities to achieve healthy community. However, we also forget one element, which is irregular migrants and other migrants that are impacted by climate-related disaster. In this regard, universal health coverage need to also advance protection to those who are in need, to those who are displaced because of the rising threats to our environmental sustainability. And I thank you very much.
Thank you very much, Samuel. I'd like to give the floor now to Kennedy Achakoma, to be followed by Makura Onipogi, please. Kennedy,
Thank you very much for the opportunity. I think that the right to health is basic and an essential asset for improving human conditions, and for that matter, migrants. The critical point is how to reach migrants, because they are the most marginalized and hidden groups in society. And if you look at some of these things, one of the measures to progressively realize universal healthcare in Ghana has to do with the National Health Insurance Scheme. They have gone beyond to provide certain innovative measures, an app where people can, new people can register with, the premium is about roughly $2 for an adult and 0.7 cents for a child. They also have a mobile app platform for people to renew their cards and pay the premium. But the challenges have to do with the legalities. Whilst the Constitution and other international instruments allows for access to health to be free, there's that legality barrier dealing with only legal migrants. So how do they have access to this universal health care? And even those who have the ECOWAS card cannot renew their premiums, cannot renew their cards. How do they get access to health? So it is about time we involve parliamentarians, those enacting the laws, those representing people, to be aware of some of these barriers so that policies that are enacted to ensure that people have access to universal health care are in line with the constitutions of the countries and international instruments. I think that this is the way to go. Thank you very much.
Thank you indeed. May I now call upon Makura to take the floor, to be followed by Ida Molina. If you may please unmute yourself, Makura. Or let's, Ida, maybe we can start with you then.
Hi, I would like to congratulate you. Yes, no, this is me.
Alors,
this is
je dis
Ida.
bonjour à tout le monde et je remercie beaucoup pour les panélistes. C'est vraiment un sujet qui nous porte à cœur. Nous, en Guinée, c'est vrai qu'on est un pays de départ, mais nous recevons beaucoup de migrants parce qu'on est entouré par des pays qui sont souvent en guerre ou là où il y a des incursions des terroristes. On a beaucoup de migrants. Et chez nous, la couverture santé, c'est maintenant là qu'on sort la tête de l'eau par rapport même à ceux qui travaillent. Donc, on n'a vraiment pas de politique par rapport aux travailleurs migrants. Je voulais vraiment savoir comment les autres pays qui ont pu intégrer ce programme dans la politique des nations n'ont qu'à vraiment nous donner leurs exemples pour qu'on puisse faire comme eux. Je parle en tant que syndicat et coordinatrice sous-régionale du réseau africain. Je vous remercie.
Thank you very much. And apologies, Ida, you can speak now, to be followed by Fatou Yagne.
Thank you very much. On behalf of Por Ti Mujer, I would like to raise the voice on behalf of the migrant women victims of sexual violence, who are totally underreported and triple victimized, as they experience all forms of gender-based violence and left without legal, social, or social policy support, not only in Spain, but worldwide. And I'd like to take this opportunity to support the concerns of Rita Sa Machado from WHO, who mentioned that it is essential primary health care addressing health determinants and sexual violence in psychosocial and trauma is a health determinant to be supported by this forum. Thank you very much, and congratulations to all.
Thank you. Thank you for your remarks. May I give the floor now to Fatou, to be followed by Feti Bugamuza. Fatou, the floor is yours.
Assalamu alaikum.
Are you hearing me?
Assalamu alaikum.
Yes.
معكم دكتور بوغاموزة فتحي، مدير برنامج هجرة للهلال الأحمر الجزائري. حقيقة الجزائر تستقبل عدد كبير من المهاجرين غير شرعيين من عدة دول، من النيجر، من نيجيريا، تقريبا افريقيا. اسباب سياسيه على الحدود، عندنا حدود متكهربه، يعني نقولوا فيها مشاكل كثير. هناك برنامج وضعه الهلال الاحمر الجزائري بالتنسيق مع وزاره الصحه، بحيث يستافدوا اطفال المهاجرين غير الشرعيين من التلقيح المجاني، يعني لا فاكسيناسيون سي غراتوي. كذلك هناك برنامج رعايه صحيه، هناك فرق طبيه تتنقل على مستوى الصحراء لدعم المهاجرين. حاليا عندنا مشروع هو حفر ابار على مستوى الصحراء في المسارات يتنقلوا فيها المهاجرين غير شرعيين، وين يسمح لهم بوجود الماء. هذه الابار مجهزه بالطاقه الشمسيه. وشكرا.
Thank you for your intervention, Fatih. And with apologies, Fatu, you may now speak again.
Thank you. Hi, everyone. My name is Fatu.
Thank
I
you.
am from
Shukran.
the Gambia, West Africa. I am not hearing. Okay. Oh, you're hearing me, right?
Yes.
I am Fatu from the Gambia. A migrant and also a survivor of human trafficking. I'm talking on behalf of the migrants and survivors of human trafficking. I can see with the mental, because I feel like, and I see that like our countries in Africa here, they don't, our government, they don't it gives us a lot of work as someone who is working on migration, right? And it really disturbs us a lot. And also the migrants working in other parts of the world, example like Arab countries, they face a lot because I experienced it, I suffered from it, and I witnessed it. It's something that the UN needs and definitely needs to work on it, because when you are in those countries, they will tell you, the people there, the citizens there will tell you, we don't care about human rights. There is no right for the migrants in these Arab countries. I'm not trying to be discriminated or harassing anyone, but in my experience, I am talking through experience. As I am talking to you, there are thousands and thousands and thousands of migrants in those jails suffering, and they are really innocent, you know. And as a migrant, as a survivor of human trafficking, I am talking on behalf of them. As I am talking to you, there are thousands and thousands of them suffering there with no human rights, because they will tell you straight away. Because I watch a documentary through, is it BBC or CNN on YouTube? The Arab guy will tell you, we don't care about human rights. There are offices here for human rights, but we don't care about them. Honestly, there is no human right in these places. I was in Kuwait, and I face a lot there, and I see what people are facing through there. That's why I become an activist, and I am standing for the rights of the migrants and rights of the survivors, so that our voices should be heard. There was this guy that just said here.
Thank you.
Yes.
Thank you for your remarks.
Thank you. There is this guy that just said, we should be involved. Yes, I believe that we should be involved. Thank you. We should be involved if we want to have solution. Thank you.
Thank you very much for that, Fatu. I'd like to make sure we leave some 5 minutes to be able to have feedback on the question raised about mental health services. If there are any responses or ideas for that, I wanted to particularly give the floor to Emilia to speak on it from the local cities and governance perspective, and then WHO Rita from your own perspective. Emilia, if you can start. Thank you.
Well, thank you very much, Poonam. I want to be very upfront with this because this is a very complex issue. Health services have not been in the picture of most of local and regional governments or of national governments, to be honest. Health services are starting to be in the picture. So let alone also for communities such as migrants. However, the importance of this is unequivocal. I think we all feel that this needs to be certainly addressed, and it involves changing the way that we provide local service provision into putting care at the center and ensuring that there is a very fluent dialogue between the recipient communities, including the migrant communities, and the service providers. So it's about educating service providers differently, training, capacity building, but also a greater investment in resources in this sense. And from that perspective, I think municipal centers for these are very, very critical to identify the needs to then redirect to the relevant services, which are professional health services. But acknowledging the issue of mental health is something that is still missing for many of our members around the world, and something that we certainly want to push for. It entails capacity building, it entails training, a different type of investment, and I think municipal care centers can be very important for this, to channel all of these needs. I'm really grateful for the inputs from the representatives of migrants and migrants that have been sharing things with us today. I'm certainly bringing homework to our constituency. Thank you very much, Poonam.
Thanks, Emilia. And Rita, from your side, anything on mental health service inclusion for migrants?
Yeah, thank you, Poonam. I think I would be here, giving some examples, but I want probably to just flag that WHO has published a compendium of promising practices that includes also the access to mental health services. And I can put after, in a couple of seconds, I can put the link in the chat, just for also you've been aware, it's a compilation of promising practices from all corners of the world, and that also WHO will be in the coming months doing it as a live repository. And also we would like to hear from you, especially with your great examples on this area of work. But having said this, what we usually preconize, and for us it's very important, I flag in my remarks earlier on, it's regarding to health workers, and here the competencies, the global competency standards on refugee and migrant health play a great part, and this means for all kind of services or provision of health services, including mental health one. But also for us, it's important to address specifically the barriers to receiving mental health care, and this can be the provision of clear information, can be outreach to at-risk groups, facilitation also of affordable and non-discriminatory access to care, regardless of the status, or facilitation, for example, of communication. So this could be some of the ideas, but just to be very here, just short, but happy to provide more inputs in other opportunities. Thank you, Poonam.
Thank you very much, Rita. So we are now at the end of this very interesting GCM talk and discussion. I'm going to have a very last look again to make sure that I haven't missed anybody who wanted the floor. Does not seem to be the case. So a big thanks to the network secretariat, to the co-leads for this work stream, WHO, UCLG, the major group Children and Youth for bringing this work forward. Most sincere gratitude to our panelists from Thailand, Brazil, UCLG, Medical Students Association, as well as MIADA. And I would encourage, of course, everyone to continue to work together in the spirit of this very whole of society and whole of government approach that we discussed today, to work through your own constituencies, whether within governments, whether within local governments, whether through non-state actors, academia, civil society, to make sure that the high-level meeting on universal health coverage and the political declaration that results from it does indeed continue to recognize the needs and also the contributions of migrants and the need to integrate human mobility issues. The 2019 UHC political declaration had explicitly recognized this, and now we are armed with the Global Compact on Migration, the impetus provided for the WHO Global Action Plan to promote health of migrants and refugees. So we do hope that this can receive the required political support, and we can continue this implementation also linked with the GCM after the General Assembly this year. So with that, a big thanks again. Wish you all a good rest of the day or evening, and see you all soon again. Goodbye.
สวัสดีครับ
Thank you all.
Thank you. Bye-bye.
Bye.
Bye bye. See
Thank
you
you.
again.
Bye.
สวัสดีครับผม
Goodbye. Thank you.